Hello, my name is Mario Rini,
And my name is Nicholas Zig.
and we are second year PsyD students from Wright State University's School of Professional Psychology. Today, we will be discussing our study, Leveling Up Social Skills, a review of inclusive video game mediated interventions for enhancing social skill development in neurodivergent youth. Our faculty advisor in this is Dr. Elizabeth Hurt. You can view our full poster using this QR code. You can also find all references cited at the end of this presentation. Without further ado, let's jump in. As an introduction, treatment for autism spectrum disorder primarily focuses on structured social skills training, behavioral therapies, and clinician-driven approaches aimed at remediating social communication deficits and repetitive behaviors. These approaches often take a deficit-focused lens, aiming to modify a correct behavior to meet what would be considered socially acceptable or appropriate. Recent publications have highlighted the incorporation of video game-based interventions and its promise in addressing these core treatment components, but in a more affirming and accessible manner. Because of this, and in order to better understand the research surrounding this intervention modality, a structured literature review was conducted. To hone in on relevant data, this review specifically aims to better understand the efficacy and practicality of video game-based interventions on the reduction of symptoms associated with autism spectrum disorder within youth populations.
In this review, 10 peer-reviewed articles were included. Articles were obtained via Google Scholar, EBSCOhost, and Wright State University library databases. The keywords are identified in bold. Studies included were those published in English and those employing inclusive video game-based interventions targeting social skill development in youth with ASD. Studies using non-game-based or other game-based methods lacking social skill measures or targeting other populations were excluded. Samples of the studies mostly consist of male participants ranging from 7 to 13 years old.
Results across included studies indicate that video game-based interventions, particularly those utilizing inclusive, cooperative, and interactive gameplay, can enhance social skills and social learning in neurodivergent youth by fostering imitation, joint attention, and behavioral modeling. With respect to an affirming approach, through clinically monitored platforms, video game-based interventions offer an accessible means to a safe and effective intervention strategy. With a vast selection of video game mediums, this method of intervention offers treatment that is adaptable to the client's needs and is easily applicable outside the therapeutic space. Studies looking into specific video game platforms have found similar findings. Minecraft has shown promise in fostering social skills development through its open world sandbox format. Online multiplayer gaming facilitates social communication through repetitive behaviors. Within clinically monitored servers, children with ASD were better able to engage in collaborative play with others, fostering strengths in cooperation, imitation, and joint attention. Within Secret Agent Society, a spy-themed interactive game targeting social and emotional skills such as social problem solving, emotion recognition, and emotion regulation, it integrates parent training and support and in-home intervention. A randomized control trial shows parent and teacher reports significant social skill development compared to control, as seen in Figure 1 and Figure 2. Findings highlight the importance of video game-based intervention in tandem with parent skills training and clinical support.
Across studies, video game-based interventions demonstrate consistent promise for improving social communication, social interaction, and other related outcomes through motivating and engaging video game contexts. Several studies highlight that gaming environments promote collaboration, modeling, and reciprocal interaction, which are critical mechanisms underlying social development. Many studies rely on small sample sizes, however, limiting the generalizability of findings and the ability to draw strong conclusions regarding efficacy. Most of the samples were also male dominant. Variability in outcome measurement was also a concern, with some studies utilizing rigorous assessments while others rely on observational data, reducing consistency across the literature. Future research should prioritize larger sample sizes and more rigorous experimental designs. There is also a need for greater theoretical clarity and specificity in defining social skills outcomes, as well as stronger justification for targeted intervention domains. Thank you very much.